Well, good evening, everyone, and welcome to our special Just for Kids presentation tonight. I'm Amy Lynn. Over the next 30 minutes, we're going to be taking your calls and asking your questions to our two child life specialists from Niswonger Children's Hospital. We want to begin by introducing our two guests with us this evening. We have Melanie Redding, a child life manager at Niswonger Children's Hospital, and next to her we have Amanda Ward, a child life specialist, also at Niswonger Children's Hospital. Ladies, thank you for taking the time out of your evening to be with us.
Thank you for having us.
Yeah, well, let's begin with some introductions so people can kind of understand. They're thinking, what is a child life specialist at Niswonger Children's Hospital? So let's sort of start there. What does that mean?
Sure, in child life, we really address the psychosocial issues that children and their families are facing during really any kind of traumatic situation, but in our case, in the healthcare setting. So our main responsibility is to make sure that the children and their families are coping well, because we know that the hospital experience can be extremely scary. So we want to make sure that we're providing those opportunities for the children to have positive experiences as well.
So you're sort of with them through this whole process.
Absolutely. So we have a team of 5 child life specialists who work along with wonderful nurses and physicians and a wonderful multidisciplinary team, but we definitely follow them throughout their entire hospitalization.
Wonderful. And Amanda, let's talk a little bit about what you do. I know each child life specialist works sort of in a different department. So what is your specialty?
Sure. I work in our St. Jude outpatient clinic, and so I work with a hematology and oncology population. And so we serve patients who have different cancers or blood disorders, and it's pretty much an outpatient clinic type population. And if they do need any kind of inpatient services, they're admitted there at Niswonger Children's Hospital.
And of course, just recently we had the radiothon where we were raising money for the Niswonger Children's Hospital and saw a lot of kids coming in and out for their treatments. And we are so blessed in this area to have such a state-of-the-art center.
Absolutely.
Yeah, that's wonderful. And I'm guessing you get to work with these patients then as they're coming in for their treatment, sort of explaining what they're going through?
I do. You know, we actually get to become part of their family away from their own. We really get to know these kids in that clinic and in that setting. And then we see, you know, unfortunately new diagnoses on a regular basis, but as the children come to us, as a child life specialist, my job in the clinic is to explain their diagnoses to them in developmentally appropriate terms so they are better able to understand that. So, you know, we'll talk to them about if it's a leukemia patient, their blood being sick, and I have different tools and resources that I can share with them. Most of our patients receive central lines. I have different teaching tools such as legacy dolls that actually have those lines that the kids can play with and utilize themselves just to kind of see how all of that works. And like Melanie was talking about, we stay with them throughout their whole time there. So once they're more used to that type of setting and those things going on, it's really kind of all about normalization for those kids, their families, and their siblings as well.
And I was going to say, she's already using terms that we can kind of understand. Yes. Your blood is sick, something a child can relate to versus sometimes what doctors will say, which is things that adults have trouble understanding sometimes.
Absolutely. Sometimes we think, you know, that whenever we have healthcare experiences as an adult, you know, we want to understand. The same thing holds true for children. And we're really tasked with making sure that they understand that on a developmental level that's appropriate for them. So we're not going to be talking about tourniquets. We're going to call them rubber bands, and IVs are going to be called plastic straws that's going to give your body a drink or some medicine. So really working with them to help them understand what's going to be happening during their stay.
Do you think that takes some of the fear out of it when the children can understand what they're about to go through?
Oh, absolutely. I think many times you can see their fear actually melt away. That's one of my favorite parts of my job, is to see a child come in and you know, knowing that they're scared and seeing those fears and helping them better understand. There's so many misconceptions that children have. Many kids think that when they receive an IV that needle stays in their arm, and a lot of times you can help them know that that's just a tiny straw, and that's just something huge for them to know. They're actually more mobile once they learn that there's no needle there at all. So, you know, there's huge misconceptions that they have, and we're able to clear those up for them.
Wow, and we want people to know that we do have a phone number up on the screen. If you do have questions for these ladies, we'll be glad to take them and answer them. We've got a lot of questions from some of our viewers already. We've been talking a little bit and promoting the show. And one of the other things we talked about is how you use play. And some of the parents were asking, how does that work? How do you incorporate that use of play in trying to help and teach them?
Sure. Well, our backgrounds are in child development, child and family studies, so we have everything really is surrounded about play, and that's the way that children learn, they grow, they understand things, and that's no different in their healthcare experience. So, for example, we may have a child going for a CT scan, and Spider-Man might get a CT scan first on our play CT scanner, and we develop a coping plan. So we can talk about how Spider-Man's going to hold really still for his CT scan, what he's going to do to pass the time, counting or thinking happy thoughts or whatever it may be. And then we're able to go with that child, and through that play they can understand what the expectations are for them, in a procedure. So then they can lay still because Spider-Man did it, know. So really it's a way just to help children, because we know that's how they understand everything is through play. I always talk about, Amanda has a famous line of that everything that we do is play, but play with a purpose. Yeah. So that's really everything that we do. So we're many times called the play ladies if we're not called the pink ladies.
I like the pink ladies, and we were just saying kind of the brightness and the smiling faces, and we've met some of the other child life specialists early on in the day, and I can only imagine when you guys walk into that child's room, their face probably lights up a little bit, like, this is for me, they're here for me.
That's true.
Yeah. Once they really understand our jobs and know that we're just a safe face, there to provide them a normal environment. Like Melanie said, everything that we do is kind of based around play. Our work is really through the lens of play, and we kind of remain that safe person throughout the length of their stay at the hospital.
Well, and I know as a parent, I can only imagine how reassuring that is for me, knowing that somebody else is going to be able to come in and help my child to understand what is going on when I myself probably can't explain it all that well. So I would imagine the parents are so excited to see you.
True, and we spend a lot of time with parents, siblings, grandparents, explaining what's going to happen as well. So even, imagine that you have your, new baby in the hospital, and that baby is going to have a procedure. So as the mom, you want to know what's going to be happening. So we spend a lot of time doing those same things for parents and siblings, siblings who, their whole life may change whenever a child's in the hospital or a new diagnosis. So we're able to, really work with the entire family and explain as well.
That is great, and a valuable link for the doctors, kind of that connector point that after they've gone in and the family is kind of trying to assess all that information, you guys can come in and sort of explain it to the family in general. That's a lot of knowledge that you guys have.
Well, I will say we work with a wonderful team, and our physicians and nurses and the multidisciplinary team are fabulous at Niswonger Children's Hospital. So they make our job very easy because they're all very pediatric friendly and really try to concentrate on providing that specialized care for the children. And it really is fun for us to be able to come in and get to, follow them and explain and answer any questions or clear up misconceptions that the kids may have.
Absolutely. You just never know what's going on in a child's mind. They see it on TV and now it's about to happen to them. So being able to sort of navigate that path a little bit better. Well, we're going to take a quick break. We want everybody to know this is the number to call if indeed you have a question, you would like us to answer that. Maybe your child is about to have a hospital stay or a doctor's appointment that you're a little bit nervous about. We can ask those questions to our guest tonight. So we're going to take a break and we're back with more right after this.
Niswonger Children's Hospital, just for kids.
Babies withdrawing from drug dependency, also known as neonatal abstinence syndrome or NAS, is a growing issue in our region. If you've used prescription opioids or street drugs, ask your healthcare provider about long-acting birth control. Prevent an unintended pregnancy and a baby who could experience NAS.
If you would like to help Niswonger Children's Hospital fund a unit specially designed for these babies, visit niswongerchildrensradiothon.com.
Just for kids, because one size doesn't fit all.
At Niswonger Children's Hospital, your children receive state-of-the-art medical care from world-class physicians and caring team members. Our family-centered environment and pediatric-trained medical staff provide your family with the very best in quality health care. But, more importantly, your child receives the one thing that matters most: hope. Niswonger Children's Hospital. where hope rises.
Niswonger Children's Hospital, just for kids.
Our region is seeing a drastic increase in babies born exposed to drugs. When a pregnant woman takes certain drugs, prescribed or illegally, her unborn baby can develop drug dependency. Babies born dependent on drugs can experience a variety of withdrawal symptoms known as neonatal abstinence syndrome. If you would like to help Niswonger Children's Hospital fund a unit specially designed for these babies, visit niswongerchildrensradiothon.com.
Just for kids, because one size doesn't fit all. I am able, I am strong, I am able, I carry on. We are able, we are strong, we are able, we carry on.
Well, welcome back, and again, we want to thank you for tuning into our special program this evening, talking about the Child Life program at Niswonger Children's Hospital right here in Johnson City. Tonight, we have Melanie Redding, Child Life Manager, and Amanda Ward, Child Life Specialist, here with us. And again, ladies, thanks for being here tonight.
Thank you.
Learning so much about this very valuable service that you guys offer at the Niswonger Children's Hospital. And of course, we've talked a little bit about St. Jude's, but I understand there are several different Child Life Specialists in different departments. So tell me a little bit about those departments.
Sure. We recently have been expanding the Child Life program, so that has been very exciting. About 6 months ago, we expanded into our pediatric emergency department. So we have a Child Life specialist there for 40 hours a week. So you can imagine that she stays busy whenever we have sutures, which we call string band-aids at the hospital. Lots of different procedures and things for her to explain. We also have Camille, who was on this morning. She is in charge of our 24-bed pediatric unit, so we cover that area, and that's where we have our playrooms, our teen room, fun things for the kids who are there for inpatient stays. And then we also are covering the pediatric intensive care unit, which we have a 10-bed unit there at Niswonger, and then of course the clinic as well. And then we just hired a new Child Life specialist about 3 months ago, and she is helping us expand into our outpatient surgery area. And so that's a very exciting thing, because we know we see so many kids who are scared whenever they're coming in for any kind of surgery. So that's going to be a really great benefit for those patients and families.
Well, and even some of the things that we don't think about, getting your tonsils out or getting tubes put in your ear. I mean, everything, when it's you and it's your child, everything is a really big deal, even though those are very common procedures, but you still want that explanation.
Yeah, and I think too, we talk all the time, even something as simple as the blood pressure cuff, taking a child's blood pressure. We're contacted by our nurses, you know, to be able to come in and provide procedural distraction for something, because there's so many things that can be invasive to children. You know, even just riding their bed through the hospital. We'll talk about how it's a bed with wheels, and we're going on a ride on the elevator. You know, all those things are very foreign and strange to kids. So any kind of explanation that we can provide really helps provide them comfort.
And it certainly makes it a little bit easier, I'm guessing, for the medical doctors and the nurses to do that, because it's so important that they sit still, or it's so important that they, you know, hold their body a certain way.
Absolutely.
It is. They need the best readings that they can get to take care of these kiddos. So, you know, sometimes, and through a little distraction too, that's one of the great things that we do for our kids, whether it's blowing bubbles or reading books. We have great light up toys just to kind of get them through those really quick procedures, whether it's a temperature or blood pressure check. We're here to provide those services too. So
one of our favorite is respiratory treatments, blowing bubbles.
Keeping
the mask on.
Yes, absolutely. We do have a phone number up, so if you have a question, we welcome your calls. We are getting some calls this evening, and wanting to talk a little bit about somebody else obviously interested in this type of a career, wanting to know where you can get certified. So maybe tell me a little bit about your background and how you guys got into this particular job career.
Sure.
Yeah.
I'll go ahead. So I actually graduated here locally from East Tennessee State University, and I didn't declare a major until I was a sophomore. And I knew I wanted to work with children and families and help them in some way. Part of me wanted to be a nurse, part of me wanted to be a teacher. I finally declared a major of child and family studies, and someone entered our classroom one day and talked all about child life, and I knew that that was for me. So to become a child life specialist, it does require a bachelor degree, and after that, it's a pursuit basically of the certification. And to do that, now basically you will need a practicum, close to 100 to 120 hours, and that's basically a shadow experience alongside of a certified child life specialist. And after that is the internship, which is roughly about 460 hours, and that's hands-on learning under a certified child life specialist as well. And once all of those requirements are met, you can sit for certification, which is a national certification through the Child Life Council, and all of those requirements can be looked up at childlife.org online.
Oh, wonderful.
So, yeah.
Well, we will have that website on our website coming up later tonight in case you would like more information as well. What about volunteers? Do you guys work with some volunteers?
We could not do what we do without our wonderful volunteers. In the Child Life Department, we have specific volunteers that really support all of those play opportunities and provide normalization for the kids when they're in the hospital. So we have volunteers who'll play with kids in the playroom, at bedside. The messier the art activities, the better.
Oh,
You know,
wow.
we love paint and glitter and all those fun things. So, but our volunteers are a huge support, and we talk about all the toy cleaning and all the things that the volunteers help us with as well, because obviously we're wanting to keep children safe in every way. So we have a few slots available still in the Child Life Department for volunteers, so people can, you know, contact us about that. We are just, since we're expanding in our emergency department, we have a few slots available there. So we could not do it without our wonderful volunteers, not to mention all of the special visitors, community volunteers, our pet therapy volunteers who come in, you know, on a weekly basis to do things for the kids and their families.
And it's kind of part of giving back, isn't it, when we have such a great facility like Niswonger Children's Hospital right here in our backyard. And of course, as we saw through the Radiothon, businesses and community members and grandmothers and parents, I mean, everybody kind of coming together to give what they can to make sure that the hospital continues to get what it needs. I mean, it really is our hospital.
Absolutely. Just today I had a donation come in from a former patient who was a newly diagnosed diabetic, and she was provided with arts and crafts while she was in the hospital, and that helped her get through that tough time. And her dad stopped by the hospital today and dropped off some crafts that she wanted to deliver, and that was her idea. So you know, at just such a young, tender age of 6 years old, she was already giving back. So.
And we're starting to see, of course, the statistics with the numbers and continuing to climb when it comes to childhood diabetes and different chronic illnesses. And of course, you guys, that's where you come in and explain, I would guess, to mom, dad, and child the changes and how that's going to relate.
Absolutely, and siblings as well. Whenever we think about a diagnosis, and especially one of diabetes, for example, you think about all those scary things, the finger pokes, the insulin shots, really, you know, any changes they may have in their diet, how they're going to address things with their friends, how they're going to explain these changes. So those are all areas that we address with the kids and their families and develop a coping plan. You know, recently we had a new diabetic, and we're going to figure out how we can just get through your finger pokes and your insulin injections today. You know, so we're going to count, we're going to hold mom's hand, we're going to squeeze this really gross ball, whatever it may be, you know, to help us get through. And then our role is to communicate that with the rest of the team. So our nurses are fabulous about allowing children choices, which we know in child life is so important. They have no control when they're in the hospital. Someone's telling them when to get up, and they're waking them up, and they're telling them what they can eat and what they can't eat. So we try to allow those choices, so that diagnosis isn't as scary. So you get to pick the finger you're going to do your finger poke on, and which leg or arm do you want your insulin injection in. So allowing any kind of choice is really a thing that we really try to work on as well.
And it seems like it's almost baby steps, getting them to sort of understand the changes that are going to be made.
Absolutely.
And of course, you see that, I'm sure, in your department as well, with kids coming in and out and facing different procedures and different types of treatments.
Absolutely. It's a day-by-day basis to work with them and to gain that trust and, you know, help them step by step and day by day. But Kids are so resilient, and I just love to see the milestones, you know, that they reach along the way. And each kid's journey is different and separate, and it's their own. And I love to see them embrace that and make it their own. And I'm so proud of every one of them.
I bet you guys have strong relationships with the children.
We do.
Yeah.
We love them, every one of them.
I'm sure your refrigerators at home are set with lots and lots of pictures and their artwork.
Their artwork,
exactly.
yeah, things that they do. Well, and it's so important in child life too. You know, we do a lot of therapeutic play and medical play, and so we think about new diagnosis, and we'll have children who, it's amazing how they'll reenact their own healthcare experience. So if they're having their port accessed in the clinic, or if they're a diabetic, they want to give finger pokes to the doll or whoever, you know, whatever we're working with. So it's amazing to watch them.
Yeah, play is so important, and bringing it down to their level. I mean, that's just crucial for what they're about to go through, making such a painful process just a little bit easier. Well, we are almost out of time. We want to give you another opportunity to call in your questions. Our phones are ringing, so we're going to get those questions during our break, and we will answer them coming up here in just a few minutes. We'll be right back.
Niswonger Children's Hospital, just for kids.
Babies withdrawing from drug dependency, also known as neonatal abstinence syndrome or NAS, is a growing issue in our region. If you use prescription opioids or street drugs, ask your healthcare provider about long-acting birth control. Prevent an unintended pregnancy and a baby who could experience NAS.
If you would like to help Niswonger Children's Hospital fund a unit specially designed for these babies, visit niswongerchildrensradiothon.com.
Just for kids, because one size doesn't fit all.
At Niswonger Children's Hospital, your children receive state-of-the-art medical care from world-class physicians and caring team members. Our family-centered environment and pediatric-trained medical staff provide your family with the very best in quality health care. But, more importantly, your child receives the one thing that matters most: hope. Niswonger Children's Hospital, where hope rises.
Niswonger Children's Hospital, just for kids.
Even a supervised drug replacement therapy program can affect a woman's unborn child. The baby may be born dependent on the drug and experience neonatal abstinence syndrome. If you're pregnant and taking methadone, Suboxone, or Subutex, find out the facts about the health of your baby.
If you would like to help Niswonger Children's Hospital fund a unit specially designed for these babies, visit niswongerchildrensradiothon.com.
Just for kids, because one size doesn't fit all. I am able, I am strong, I am able, I carry on. We are able, we are strong, we are able, we carry on.
Welcome back to our special program tonight, talking about children who for some reason or another are facing medical problems. Maybe they're diagnosed with an illness, maybe they were injured in an accident and need surgery. Whatever the issue, child life specialists are there to assist, and that is what we're learning tonight. And we are so fortunate to have both Melanie and Amanda here with us answering your questions. We did get some questions through the break, parents wanting to know how they can help teach their kids at home, how they can kind of use some of your knowledge to help them help their kids when they're at home.
Sure, we talk about this a lot because we know that any kind of experience at the doctor, going to the dentist, can be really scary for children. And so one of the first things that we always advocate for is for families to be really honest with their children, explain things on their own developmental level to where they can understand, and really making sure that we're considering the time that we tell those kinds of things. So for example, if we have a 4-year-old who's going for a doctor visit and they may be going to get vaccinations, we wouldn't want to tell them until we're closer to the visit, whereas a teenager, for example, could have that information the day before. But really being honest and thinking about ways to help your child cope. We call it, we take a little distraction bag everywhere we go with some fun toys and things like that, iPads, anything that really can provide distraction and help your child cope through those things is very important. But honesty and explaining what's going to happen and helping them understand how to cope through that is very, very important.
I always say take a deep breath when they ask you that question and you think, oh, I would love to just say, no, it's not going to hurt at all, but that is not true.
Yeah.
So honesty, anything else you want to add to that, Amanda?
Just reassurance to your child that you will be there every step of the way with everything that's going on. And just to hone back in on the honesty, you know, we want to set these kids up for positive experiences. For future healthcare experiences. So, you know, we never want to lie to our kids because it can lead to negative experiences. So,
And they're going to find out, and then they're going to be upset with you because you lied to them. And we talk a lot about kids tonight. We've talked, but you also deal with a lot of teenagers and helping them when they're going through things as well.
Absolutely. The same thing is true for teenagers. We want to explain things that are going to happen to them in appropriate developmental terms, but really we find ourselves a lot of times forming a friendship with the teenagers, especially. They want someone to share their thoughts with, their emotions. We'll do different activities with teens, like if there's a new diagnosis, we might do a journey jar where we're going to document a journey through an illness and with a goal at the end, or we may do during procedures, conversations or guided imagery to really help those teens cope as well, because on the outside sometimes they have that tough exterior. I don't need any help, I don't need my parents, I don't need these things, but at the same time we find that they do, and we really have great opportunities with the teenagers as well.
And I bet it's an opportunity to sort of let them share some things that maybe they won't share with their parents. You know, it's a little bit easier maybe to talk to somebody that doesn't have that emotional attachment right away.
yeah, we find that happening all the time. A lot of times we can just open up an opportunity for expression for them, and it's through activities or art activities, and a lot of times these teens will share stuff with you that they wouldn't share with their parents, and it's actually coming out through their artwork or activities, and you know, sometimes it's things that we need to share with their healthcare team after that. So we actually get some, you know, really important information from these kids that they wouldn't share with their families.
I think sometimes they want mom and dad to know they're fine, it's okay, and
Sure.
when somebody else comes in, it's like they can be a little bit more honest, and maybe they are kind of scared, and you can sort of help them and explain that process.
Well, I think too, giving them those opportunities. You know, we talked about allowing choices. The same thing is true. We know that teenagers, I mean, they're ready to spread their wings and fly, you know, and then all of a sudden they're in the hospital and there are no, you know, not a lot of choices. So allowing them those choices again are really, really important.
Well, we thank you so much for joining us tonight. We've learned so much, and we want to give you guys both sort of an opportunity, maybe some advice for parents out there. We know eventually life is a roller coaster, and it's full of these things, and we may have to face some of these conversations and certainly doctor visits and even just the everyday things. I mean, give some of us some advice.
Sure. Well, I would just say that if you have a child who is going to be visiting Niswonger Children's Hospital and you feel like that your child could benefit from meeting with a child life specialist, if you see fears or anxieties or things that you think, you know, this could be something I really need to worry about, that someone can help, we would encourage them to ask for a child life specialist, because we would love to meet them and be able to provide, you know, some help during those difficult times.
Wonderful. And Amanda?
Yes, pretty much same thing. Please utilize our services. Our services are actually free to all of our patients at Niswonger Children's Hospital, so we want to be able to offer those to all of our patients and families.
Well, we are so glad that you guys are there, and we thank you for your time today. And wonderful to know that when you're going to the hospital in all these different areas, that there are child life specialists, and they can help you to make this process just a little easier. Thank you so much, ladies, for joining us tonight. And thank you for joining us. We hope that you have learned a lot through this special presentation. You can look for another Just for Kids presentation coming up in just a few months. Great to have you with us. We're starting over. Coming up next, going to be a lot of fun. Thank you, ladies.
Thank you.